A proposed bill in Tennessee may be the difference between life and death. As recent CDC data says, people in the U.S. have died of drug overdoses more than any previous year, and opioid overdoses are at a record high, listing more than 2,000 deaths in Tennessee in 2020 being opioid related.
This bill would require doctors to offer Naloxone prescriptions to those who are prescribed opioids. Karen Aguilar tells us the difference this bill could make.
The Tennessee Department of Health says nearly 600 people died from prescription-related opioid overdoses in 2020.
I got a call one day and they were screaming in the phone saying, you know, he's not breathing.
Tammy Green describes the bone-chilling phone call she received about her beloved son, Seth.
I just put the phone down. I was like, I'm not going there, and I ran outside.
The shock left her unable to handle what she was about to hear next.
And my son was poisoned by fentanyl.
Her son fatally overdosed last year, but she says her son's addiction began with an opioid prescription due to an injury in 2004. Even though it's been on the decline and not always the case, people who are advocates for recovery call prescription opioids a gateway towards addiction, then potentially death, leaving a wound hard to heal.
The big hole that you will always have. You just know you're always going to have that, and you miss them real bad.
It's a scenario that has happened to thousands of grieving parents, and lawmakers are trying to change things with this new bill. It makes doctors offer a Naloxone prescription, which counteracts an overdose, to people who are also prescribed opioids.
Did you know about Naloxone at that point when he OD'd?
I wish I had have known. I wish you had have had it.
Brian Sullivan with the Prevention Alliance of Tennessee says this new bill will make the life-saving drug more accessible. He says he wouldn't have been alive if it hadn't been accessible to him when he was suicidal and had an opioid overdose.
I lived very close to EMTs, and they were there within a matter of minutes and administered the naloxone. I don't know how it would have gone if that not were the case.
Which is why he and Green say this new bill is a step in the right direction.
I am so glad. I don't want other mothers to have to go through this.
The bill passed the Senate and the House and is awaiting Governor Bill Lee's signature. Reporting in the studio, Karen Aguilar, Local 3 News.